Endocrine therapy is a mainstay of therapy for patients with estrogen receptor-positive breast cancer. However, many patients relapse, often due to treatment resistance. Giredestrant is a highly potent, non-steroidal oral selective estrogen receptor antagonist and degrader, or SERD. Giredestrant is well tolerated, with encouraging anti-tumor activity in early and metastatic breast cancer, both as a monotherapy and in combination with the CDK4/6 inhibitor palbociclib. Coopera breast cancer is a Phase 2 randomized open-label neoadjuvant study. Patients received either the aromatase inhibitor anastrozole or giredestrant for a 2-week window of opportunity phase. They then received 4 cycles of anastrozole or giredestrant plus palbociclib prior to having surgery for their breast cancer. The primary efficacy endpoint was change in Ki-67 score from baseline to week 2. Other endpoints included complete cell cycle arrest at week 2 and safety. Ki-67 can be used to assess response at different stages during the early breast cancer treatment journey. Decreases in tumor cell proliferation measured by Ki-67 have been associated with improved long-term outcomes in patients with early-stage disease. At week 2, the relative reduction in Ki-67 score was 75% in the giredestrant arm versus 67% in the anastrozole arm. This was a statistically significant difference, meaning that the study met its primary endpoint. Importantly, Ki-67 was also suppressed consistently in patients with high or low baseline levels of Ki-67. At week 2, a higher proportion of tumors from patients treated with giredestrant versus anastrozole exhibited complete cell cycle arrest. This was observed in both the high and low baseline Ki-67 subgroups. In the overall safety population, there were no grade 3 to 4 adverse events leading to treatment interruption, or serious adverse events related to giredestrant treatment. The most common adverse events during the 2-week single-agent window of opportunity phase were hot flash and nausea in the giredestrant arm and arthralgia and diarrhea in the anastrozole arm. Coopera breast cancer met its primary endpoint of superior Ki-67 suppression with giredestrant over anastrozole treatment. This is the first randomized study to demonstrate the superior anti-proliferative activity of an oral SERD over an aromatase inhibitor in patients with estrogen receptor-positive, HER2-negative early breast cancer. Consistent with previous studies in metastatic breast cancer, giredestrant was well tolerated. A comprehensive giredestrant clinical program is ongoing, with lidERA breast cancer and persevERA breast cancer.